Coping is a strategies that it involve a strategy that we utilize in order to sort of get by. And then should I say something, and who do I say it to, and what might they say? That's a whole lot of emotional baggage. Hello, Dr. Jeff here from Essential Behavioral Health. Today we're going to be talking about psychotherapy, the different forms, formats, and benefits of individual therapy. In this day and age, many people experience a wide range of emotional, psychiatric, behavioral, and other issues that could benefit from individual therapy. The triggers to those issues could be a wide range of experiences that they've had in their lives. Traumatic losses, the challenges of losing a job, loss of a loved one, the pressure of employment, of school, of the variety of issues that are going on in the world, such as the pandemic, political upheaval, and otherwise, all this puts stress on human beings that are challenged to cope with it. There's a difference between coping with these issues and dealing with these issues. Coping is a strategies that it involve a strategy that we utilize in order to sort of get by, to minimize the stress that we experience to get through the day to the other side. But are we really dealing, with the ramifications and the underlying issues? Not all the time. In that way, sometimes individual therapy could help. People ask me all the time, how could talking about my problem solve anything? Or how could you, who doesn't know me, tell me how I can deal with these problems better? A couple of reasons. Number one is that, when we hold it inside, a lot of times we don't remain objective about our issues. We're not able to see, how we are distorting things, how we're focusing on one thing at the expense of something else. And sometimes just by putting something out there, putting something out there on the table for you and your therapist to describe and to discuss, that allows, different angles and different insights into the roots and underlying causes and different perspectives on those issues. But we also realize that there's a challenge to talk about issues, to talk about problems. We can have family dynamics and come from families in which, emotional issues and these type of issues weren't discussed. And there's a stigma against talking about problems out loud. And then also they might have gotten feedback from loved ones that their problems aren't important, or they can't be helped, or they'll even worse be ridiculed, or even, looked down upon as weaknesses that they've had these issues. So just as challenging it is for somebody to realize and to think that they have a problem, and then to realize what can I do about it, and then should I say something, and who do I say it to, and what might they say, that's a whole lot of emotional baggage and emotional issues or emotional weights that could be added to a process before coming into a therapy session. The variety of issues that people experience require different levels of therapeutic intervention in the first place. Some people are dealing with very limited problems. How do I get through the next week or two? Or how do I deal with something that just recently happened to me? Sometimes a more counseling type approach, meaning like a short-term, focused on the specific issue at hand, preparing them to get through something or helping them deal with something that happened, might be what's required. Other times, more of a long-term issues have been uncovered that have come to the forefront that might require more of a prolonged and focused help when it comes and with maybe perhaps the assistance of medication and otherwise to help them get through sort of the short-term but very acute situation. Other times people come in with chronic concerns that have burdened them for a long period of time. Obviously if somebody has been dealing with something for a number of years, it might take several months and if not longer for them to fully come out of it. However, having a comprehensive assessment by understanding both the roots of these issues, how it's affected their lives, both, emotionally and also potentially, psychiatrically, and then developing a treatment plan in order to address this is a way that we can comprehensively deal with the problems at hand, have the most efficient and effective treatment utilized for them. A lot of times in my over 25 years of doing this, I've dealt with plenty of clients who have come in with one set of expectations about what therapy is and then discover a whole new set of expectations. For example, or have a whole new experience. So they might have expected, I'll come in for a tune-up and talk for a couple of weeks, and they end up staying, and voluntarily they end up staying for months. Because initially, even after the initial problems are over, they find the therapeutic frame, of talking to somebody that they trust, who knows them, who is, unbiased, but definitely on their side and working on their issues, very positive. One such woman, for example, came in, she was mandated for 8 sessions of anger management. She had made her appointment, she had already made her 8 sessions, like scheduled, paid for them otherwise, and that's all she was doing because she was court mandated. Lo and behold, 8 months later, long after the 8 sessions had been exhausted, she still continued and continues to this day to explore her issues related to the underlying triggers for her anger and depression. So yes, sometimes the treatment plan, that's why we actively do treatment planning. The initial treatment plans based on their initial presentation, is tailored to the issues that they come in with, but then it's a dynamic living, a document and guideline to determine how, treatment has progressed, is progressing, and then incrementally setting goals, to ensure that the person's receiving the treatment that they need for the issues that they're experiencing. So in sum, verbal psychotherapy times presents a challenge to people who have had long-standing stigmas against, talking about their problems or denial about their problems potentially too, and we at Essential Health, are fully cognizant of how, difficult the initial process of coming through the door is. But I guarantee you that once you come through the door and you meet with your therapist who does an assessment and will listen and understand to your problems and put into context where the problems are, how they are best treated based upon years of clinical experience, and keeping it, client-centered and focused on the individual, that you will have a positive experience and be able to show great gains in a small period of time once you start treatment. For more mental health topics, please click on the links below, and if you would like more information about essential behavioral health, the information is listed below as well. Thank you.